Intensive short-term dynamic psychotherapy has revolutionized the treatment of complex psychological issues. It provides a structured, efficient, and highly effective approach to therapy. Hey everyone, I'm Dr. Nowruzi, and today I want to talk about a modern and powerful technique in dynamic psychotherapy, intensive short-term dynamic psychotherapy, or ISTDP. Intensive short-term dynamic psychotherapy was developed by Dr. Habib Dawanlu in the 1960s. It represents a significant advancement in the field of psychodynamic therapy by actively challenging resistance and facilitating rapid emotional breakthrough. ISTDP has revolutionized the treatment of complex psychological issues. It provides a structured, efficient, and highly effective approach to therapy. Previously, we mentioned that Freud and Breuer used hypnosis to work with patients suffering from psychological conditions. Their work led to the birth of psychoanalysis, whose fundamental goal is for the client to truly experience their feelings and emotions. However, these feelings are often painful, conflictual, and unacceptable, leading the client to create barriers to experiencing them. These barriers are known as resistance. The therapist's task is to mobilize forces to overcome this resistance. The method a therapist uses to overcome resistance form the basis for different types of psychodynamic therapies. Breuer's method involved using hypnotic suggestion. Freud initially used the method of hypnotic suggestion as well. However, Freud eventually innovated a technique that became a turning point in psychotherapy, the technique of free association. In free association, patients are encouraged to speak freely about whatever comes to their mind. Despite its innovative approach, the technique of free association had many flaws. These flaws, along with other criticisms of psychoanalysis, led to the reconstruction of psychoanalysis. This gave birth to psychodynamic approaches that, while adhering to the fundamental principles of psychoanalysis, aimed to develop the therapeutic methods that are shorter, more economical, and have a more organized and integrated structure with objective and measurable concepts. Dr. Habib Dawanlu's ISTDP was his solution to the problems he identified in traditional psychoanalysis. He built on the work of previous psychoanalysts like Freud, Breuer, Sandor Frenzy, Otto Rank, Peter Sifnos, and David Malan, who aimed to address the issue of resistance in psychotherapy. Malan makes clear, however, that the ability to maintain a focus in his technique depends very largely on the careful selection of responsive and highly motivated patients with an underlying simplicity of psychodynamics. The same applies to the technique developed by Sifnos. The result is that such techniques are applicable to only a small segment of the patient population. The fact remains that the bulk of patients suffer from long-standing complex psychoneurotic disorders and character neuroses and are neither well-motivated nor responsive, but poorly motivated and highly resistant. It is this problem that must be solved if short-term psychotherapy is going to have any impact on psychotherapeutic services and the mental health of the community. Therefore, it was this problem that Dr. Habib Dawanlu, the Iranian psychiatric professor at McGill University in Canada, addressed himself in the 1960s and eventually found a solution. Dr. Habib Dawanlu developed his technique of intensive short-term dynamic psychotherapy, or ISTDP, that has since been taught worldwide. David Malan hailed Dawanlu's technique the most important innovation in psychology since the discovery of unconscious by Sigmund Freud. While traditional psychodynamic techniques like free association were passive, Daolu introduced an active and structured approach to mobilize forces against resistance. It allows therapists to actively challenge and overcome resistance, helping patients confront and experience repressed emotions much more efficiently. One of Damolou's significant contributions was shifting the emphasis from Freud's focus on sexual drives to attachment needs. Instead of centering therapy around the idea that unconscious sexual desires drive behavior, ISTDP highlights the importance of unmet or unsatisfied attachment needs, such as those related to connection, love, and care. By addressing these core attachment needs, ISTDP helps patients confront unresolved emotional pain and heal from deep-rooted issues. ISTDP is based on the following principles. Number one, overcoming resistance. The core aim of ISTDP is to help patients fully experience their true feelings, which can only happen by confronting and overcoming resistance. In traditional psychoanalysis, resistance was seen as a barrier. In ISTDP, Damoulou viewed resistance as an opportunity, believing that it indicated the presence of painful emotions that, when revealed, could be processed and resolved. Number two, active therapist role. Unlike traditional passive techniques, ISTDP requires an active therapist. The therapist consistently confronts resistance, applying pressure and challenge to help the patient break through defense mechanisms and directly experience their emotions. Number three, focus on true experience of repressed feelings. ISTDP emphasizes bringing repressed emotions to the surface and helping patients fully experience and process them in relation to their current lives, past experiences, and therapeutic relationships. Number four, short-term structure. One of the defining features of ISTDP is its efficiency. Therapy is designed to be short-term and intensive, requiring fewer sessions than traditional psychoanalysis. Damolou's method typically aims for a deep resolution of emotional issues within a short time frame, focusing on long-term psychological change in fewer sessions. Number five, emphasis on nonverbal cues. ICDP places great importance on identifying and interpreting nonverbal signs of emotions, such as body language. Damoulou pioneered the use of audio and video recordings in therapy sessions to capture these subtle cues for better analysis. Number six, no dependency on free association. Traditional psychoanalysis relied on free association to reveal unconscious thoughts, but ISTDP uses direct intervention to address resistance, making therapy more focused and efficient. Number seven, focus on anxiety. Damoulou extended Freud's ideas by emphasizing the role of bodily sensation and physical manifestations of anxiety in his therapy. Number eight, shift from sexual drives to attachment needs. Unlike traditional psychoanalysis, which emphasized sexual drives as the primary motivator of behavior, ISTDP focuses on unmet attachment needs. Damoulou believed that emotional conflicts stem primarily from disrupted or unmet attachment needs, such as the need for love, connection, and safety, rather than purely sexual desires. Thank you for joining me on this video. If you found this video helpful, don't forget to like, comment, and follow for more content on mental health and therapy. See you next time.